My name is Jennifer Benastro, and my presentation is Therapy for Sexually Abused Children. The facts. In the US, 1 out of every 3 females and 1 out of every 5 males have been the victims of sexual abuse before age 18. 500,000 babies born in the US this year will be sexually abused before they turn 18 if we do not prevent it. Sibling sexual abuse is the most common underreported form of sexual abuse. 90% of child sexual abuse victims know their abuser. Every 8 minutes, Child Protective Services substantiates or finds evidence for a claim of child sexual abuse. Out of all victims under 18, 2 out of 3 are ages 12 to 17. 34% are under age 12, 66% ages 12 to 17. The problem. Sibling child sexual abuse survivors are unlikely to receive professional intervention, so most of these children have no choice but to carry these problems into adulthood. 35% of child sexual abusers were once abused themselves as children, and therapy or counseling will help reduce the possibility of the victim repeating the pattern. Even though there is an abundance of research that states youth need counseling after being sexually abused, the issue stands of how well memory serves for a vulnerable individual. There is a chance that mental health counseling can introduce or reinforce errors with memory. The solution, therapy for victims. Some types of therapy won't work for certain children. It is up to the family and the team helping the child to be persistent to find what combination of therapy and counseling will work best for them. Prosecutors may want the child to wait to attend therapy until after being in court, as false memory, memory distortion, and inaccurate memory can hinder the court proceedings. This, of course, leads to the child not being able to access needed services to assist with intervention and recovery. Memory. The data analyzed below comes from a longitudinal project that examined the long-term mental health, legal attitudes, and memory outcomes of alleged CSA victims, completed by research teams from the University of Denver and the University of California. 71 participants were used for the study, with 3/4 being female. The sexual assault profile was first built that is later deemed Time 1. The data examined was from long-term mental health, legal attitudes, and memory outcomes from alleged child sexual abuse victims aged 3 to 16 when the original police reports were made. The participants were asked if they participated in psychological counseling before or after prosecution. Participants are then interviewed 10 to 16 years later by phone, questionnaires, and in-person interviews. This is referred to as Time 2, a post-traumatic diagnostic scale. From the information reported in Time 1 versus Time 2, the memory scores were calculated. The findings. Participants who received counseling reported fewer additional details at Time 2 than Time 1. The research behind this was that abuse at Time 1 was still more severe than by Time 2. It is found that psychological therapy may predict better long-term memory of abuse-related experiences. Therapy doesn't hurt the trial proceedings and should be allowed. Findings like this are very important because it leads the legal authorities to allow sexually abused children to get therapy immediately instead of waiting until after the court proceedings, which could cause more harm than good. Experimental therapy. An experimental SOAR gestalt-oriented 4-stage model of therapy was used on 74 participants ages 18 to 66. This therapy was considered non-traditional and used to help counselors form similar programs for patients. So this is a SOAR model that goes over some of the basics of the process. So there's 4 stages. The phase 1 is focused on safety and stability and lasts about 12 weeks. Phase 2 is working through trauma, lasting 16 weeks. Phase 3, the focus is reconnection, lasting 12 weeks. And phase 4, the focus is aftercare, and it lasts 12 weeks to a year, depending on the patient. So these are the stages of therapy with a little more detail. In the first phase, safety and stabilization, this stage lasts 12 weeks. Patients will begin the therapy by finding stability in their lives. They will also be informed of the effects of the trauma they endured. The second phase, working through trauma, the stage will last for 16 weeks. This includes the Gestalt group therapy as well as individual therapy. This will help clients work through emotions by sharing one on one and with other abuse victims in a group setting. Third phase, reconnection. This stage will last 12 weeks to 1 year. This stage is focused on helping individuals reconnect with society. And then the fourth phase is aftercare. This phase of the therapy was offered in hopes of the patients accepting help if they needed it after treatment. Therapy success. Trauma focused group psychotherapy, present focused group psychotherapy, systemic group psychotherapy, and a combination of individual and group therapies were shown to decrease the effects of ACEs moderately with small differences among the different symptoms. The symptoms that decreased dramatically were psychoticism related and interpersonal sensitivities. Conclusion. This research validates the solution to the problem I have identified by discussing and researching ways to make therapy work more for children who have been victims of sexual abuse. Instead of traditional therapies that may have not had any effect, this research incorporates the patient's needs into the treatment better than before. If a child that had been sexually abused were taken to a treatment center and led through this four-phase model, SOAR, research shows that they may have a considerable chance to become a survivor. The child will be able to break through the typical symptoms, depression, PTSD, and irrational beliefs that are common to develop in children after abuse occurs. This research is tantamount to paving the way to lessen the effects of ACEs when these children grow up to become adults. Many people that have sexually abused children were abused themselves as a child. If this abuse continues to occur, the child will grow up without any intervention or professional help. They are at risk for continuing the abuse cycle with their own children or others.